then we will be started. There we go. Okay, so we are ready to start the session. I'd like to introduce our three presenters that we have today. First, we have Ashley Halliday-Schmatt. She is the Executive Director of Northwest Michigan Coalition to End Homelessness. We have Tina Allen, who says she's retired, but she works more than most people do when they're not retired. She's currently the chair of the Balance of State COC and doing probably a plethora of other things. And then we also have Mark Vanderklip, who joins us from Connect CX as an experience and systems designer. So welcome and thank you to our three presenters.
Thank you, Jessica. You all can hear me, correct?
Yes.
Okay, great, thanks. So we're here to talk to you today about a project that we have been working on for about the last 18 months up here in Northern Michigan. It's called the Intersection of Health and Homelessness, and it was supported by the Northern Michigan Community Health Innovation Region and also continued with Goodwill Northern Michigan. So it is a project that we engaged in to change the culture of how providers are working together to sort of pull the safety net more closely together between behavioral health, physical health, and homelessness prevention, understanding the needs of our homeless neighbors first and foremost, and then giving folks an opportunity to talk about their experiences, the experiences that they've seen, the experiences of providing care to the folks that they're working with, their clients, but also the experiences of not knowing what other service providers are really there to do. And so what we want to do is a better, like I said, better tight net network to keep people from falling through the cracks between these big and somewhat disconnected services.
Thanks, Mark. So what I'm here to talk about is really to create kind of a space for how I'm assuming most of us here are all homeless service providers in one way or another, and really set the stage for how we came to the table for this project. We kind of need to come to it with some foundational understanding, and so that's what we wanted to share today. We came to the table knowing that no one system has all the answers. I think we've learned that time and time again, and I think now more than ever we have to think about how we're going to collaborate to make our systems work better for the people we have the privilege of serving. We also have to come to the table knowing that we can all do better. We as homeless service providers know that we don't have all the answers, nor do we think that we're perfect. And so coming to the table from a place of how can we make this better, and Tina will talk about this later, but really understanding or not coming to it being defensive, that our system might not work for everybody, because we know that. So how do we make it better, and how do we not let people fall through the cracks of the intersections of what we're going to talk about today. So we want to convene diverse groups of people who interact with our most vulnerable people in our communities. Mike will talk more about what we did there. Then we listened, we did some prototypes, we tested them, we'll reflect on those, and then we launched the projects. And we'll get into the details of some of the projects, and then we retest and reconvene after the projects have been in implementation for a while.
So the process that Ashley just went through is the process of human-centered service design. And my title is Experience and Service Designer. So what we do in that process is working with quantitative and qualitative research. We had done quite a bit of both at the outset of this project, understanding what the needs of all of the human beings on all sides of this conversation will be and have been, to better build relationships within networks. So the title of this presentation is, why don't you all just talk to each other? That is exactly the foundation of the work that we had done. And as Ashley said, we brought together lots of diverse people. The more input that you can get in a human-centered service design process, the better off you are. So we started out by interviewing a number of literally homeless and formerly homeless folks. We talked to them about their intersections with the health, physical and behavioral health systems, substance abuse and other interactions that they've had. We talked about their needs, their impressions, their outcomes, and understood where their questions were, because we know that it's difficult to navigate these systems even when you live in a home and you don't have to worry about where you're going to sleep tonight, what you're going to eat in your next meal. So for folks that are homeless or at risk, they are much less, I should say, capable, but much less able to navigate those systems effectively without help. So in order for us to talk effectively as a group about how those experiences were taking place, we had to provide visualizations. And I'm going to show you those a little bit later about how does the system work. So what is the experience of the individual as they are caught in these intersections? Maybe they fall through the cracks, or there's a certain point in time where neither system says, well, that, we'll take that person now. What is the information provided at the point of service, and then what do those handoffs look like, and who's responsible for those handoffs as the individual moves between those systems? Again, behavioral health, physical health, and homelessness services. And then for the other, for the Goodwill Northern Michigan portion of this project, we've been looking at other types of systems that inform and have an influence over the three primary systems that we worked with through the NMCHIR project. So we're talking about child welfare, juvenile justice, and behavioral health for youth. All of these are interconnected, and we know that each system impacts the other and impacts the experience of the individual. So we've created these visualizations by first listening, and secondly, coming back to say who's doing what, who's providing which information at what point in the process, and where are people falling through the cracks. And then we're building and prototyping these tools, testing and launching them with the providers who will be using them. So I'll turn it over to Tina to talk a little bit more about the process.
Thanks, Mark. So I want to get back to just even what the title of this session is, and why don't you all just talk to each other? And this, in Northwest Michigan, we've been trying to do some work on just systems for a long time, and we've done some work with youth where we really went out and talked to them, and every single time you hear from anyone, they say, well, yeah, sure, they're helping me here and they're helping me here, but you people don't talk to each other. So that kind of took us to, okay, we then kind of went into that world that I'm going to call the COC / local planning body, if you're balanced estate, saying, why don't these people come to our meetings? Why don't these people come to our meetings? And for years, we talk about these people from other systems that we know are related to homelessness and wondering why they don't just come to us. Well, the other thing we learned by asking them was that they're just not going to. In a lot of places, there's not enough capacity, which means not enough people to spread around to 100 different meetings. So we started trying to figure out, how do we go to them? So that's really what this is about, is if you're going to serve clients, you can't sit there in your office going, man, I wish the behavioral health people were here talking to me. You have to go to them. So that's really kind of how this started, with that idea that, like Ashley said, we were making the mistakes. We have to believe what we heard. That's what we heard. So one thing I also want to talk about before I get to the actual steps is the idea that they actually asked us when we were going to present, like, which level people needed to be at, if they should be beginners, intermediate, advanced. And I said, well, everybody can do this. But the reality is you need to already have a homelessness response system that works together and is able to be nimble enough and believes enough that they can move things around to make things better. So if you're struggling with just having access points, this probably isn't quite ready to do this, because a lot of this has to be your response. So Mark, next one, I think right now. So to reach out to other people and ask them to be part of what you're doing doesn't make sense if you can't respond to them. So, excuse me, everything we're talking about today is from the homelessness service sector perspective. So if you're working in behavioral health, then I'm going to say your homelessness people should be reaching out to you. That doesn't mean you can't, but we have to go into this assuming that we as homelessness response systems are willing to and able to make changes to accommodate some things. And there's actually a couple people on the call right now, one in particular, who worked through a discharge policy with us and is the person who's doing the action. And that came after a lot of other discussions. So first of all, I want you to know that the stuff I'm going to talk about, Mark is going to be giving you a link later. There is literally here are the steps to take to do this. It really is a how-to. So know that you'll get that when you're done. So I'll just kind of start with this. Okay, the first thing is, who do you convene? So we start this by saying, who needs to be at the table? Well, what are you trying to accomplish, right? Because that's real different. So some of the things we did, as Mark said, were discharge policies. So that was working with a very specific outcome in mind. So that's one type of thing. We had another one where we were trying to work with, we have some of you may have through our community health innovation region, we have a community connections. So it's some other people, kind of like a bigger 211, where they actually go work with people on their social determinants of health, one of them being housing. So that was looking at an opportunity for us to have some people do some additional work for us if they understood, instead of us duplicating efforts. Another one is system connections. So we're right, one of the things we'll talk about is working to try to kind of connect better with other systems like child welfare, behavioral health, juvenile justice. So those are whole system connections. So all of those things are slightly different, but they can all use this model. But when you're thinking about who needs to be at these discussions we're going to talk about, you need to have people there that know clients, that are the ones that are working with this every day and seeing the problems. We need the people who see the problems. We also need the people who at their own organizations can make policy and or procedural changes. Because if you're missing either one of those, you don't necessarily have the information you need to do anything. And they all have to have buy-in, right? Though you need to help create a conversation that allows them to see that there's a value for connecting with you to begin with. Just getting them to answer the doodle. You need to get their buy-in. This part about hierarchy is do your homework. So if you happen to know some people who are working in behavioral health field with clients, that's great, but ask them, like, who is your supervisor, or who at your organization is the one who can change policy or procedure? And that's the person you go to for the first invite. And it may be a telephone call, probably. It could be kind of a cold call, but in general, you want to be talking to the person who's at the top. So as an example, we wanted to start working with child welfare. So we went to the director. We have 3 different child welfare organizations in our area, DHHS I'm talking about. We went to the directors of those DHHS, called them in and said, here's what we'd like to accomplish. Are you willing to ask your staff to spend their time on this project? So you don't just ask staff to be part of it because they may not be able to help. You want to go to the top, be aware of the hierarchy, get permission to do it. Equalized on all sides. So you want to have the people from that system you're trying to connect with, but you also need to have your people. So in our area, we have PSH, rapid rehousing, street outreach, shelter, a call center. We made sure that a representative from each of those systems, somebody who could change their procedures, was involved in these. And sometimes it seemed like overkill, like we had 20 people, well, okay, 5 people in the room and they maybe had 1 or 2. But that's okay, because then they understand that you all care. That's a huge part of it. The other folks need to know you care. And then when you have this conversation, we'll be talking about a little bit more, it has to be an open forum. The thing about not assessing blame is kind of interesting, because one of the first projects we did was with a hospital in one of our cities up here. And they were just flabbergasted that we didn't walk in the room and start saying everything's wrong. Just the fact that we walked in and said, and we'll get to this, but tell stories, helps them understand that it didn't matter who was right or wrong. Or like Ashley said, if we were all doing it well, we wouldn't be here today. So let's just all agree that none of us are doing it perfectly. And it sets a totally different tone. And people are really happy that you set that tone so they can be heard. Relies on all parties to create the best client experience. So that's Mark talk, but what it means is that, this is about the client. This isn't about how your organization runs. And if it's easier to change this because that makes it easier for the people at your call center, no, this is about what does it feel like to the person's experience. The other is the facilitator and the scribe. So one thing we didn't put in here is that the facilitator really has to be neutral. So if you are the head of the HARA and you are facilitating, it might be a little different than if you could find someone from your United Way or some other community group, or just anyone to come in and say, hey, will you run this meeting? Because first of all, you all want to be part of that discussion. And the other is it also helps equalize, to have this person that doesn't love one side more than they love the other side. So that's really important too. And then we put in the word scribe because that means somebody to take notes. But I think Mark's going to get, in fact, I'm sure Mark's going to get more into what it means to scribe, that it really isn't just writing notes, it's looking for certain things. And he'll talk about that in a minute. And then the other thing is just believe them. So whoever you have there, no matter what they say, Ashley and I always laugh about how we've tried for years to get our call center number out, which starts with an 844. And we'll go places. Now, what you really need is like a 10-county call center. And you just have to sit back and say, then we didn't do a good job communicating that, or they would know. So you have to be willing to kind of accept blame, if for a lack of a better word, when you're on the homelessness side. Okay, storytelling. Again, creating a safe environment. You want to be somewhere where there's a nice big table. We tend to go to them instead of asking them to come to us. So I would say, hey, do you have a room where we could all meet? We need about this many people. This is what we need. So that's a big part of it, is just who you are and how you sit together. So as a facilitator, what I try to do is ask anyone who can actually ask clarifying questions. So we start by just saying, could you give us some stories about clients that you think it either worked well or it didn't work well? And during that time, sometimes people will join in. So they'll start talking about somebody and saying, yeah, but I tried to do this. Oh, I know who you're talking about. We don't use names, right? But blah, 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 blah. And so it creates a place where you can ask each other so it ends up being clarifying questions instead of, wait a minute, I did this. No, what we're trying to say is, dang, when I did this, so you're saying that didn't work, right? So you're asking the question in a different way. And you're trying to find out who was being served, not by name, but what was the situation of the person being served, who was involved, because no one ever tells this story about we were the only ones working with somebody. And if you were, that's part of the problem, right? So we figure out who's involved. And then Mark will talk more about this again, but at which point in the process did that happen? Because sometimes people walk in, these people are homeless for 3 years and now this happened. Okay, let's go back and clarify some of that. So it's clarifying what the whole story is. And then understanding that you're all challenged. I kind of mentioned that too, that nobody has the answer, but what we're trying to do is make it easy for the clients, not necessarily for the workers, right? And then we want to encourage different perspectives, lots of discussion, lots of sharing. So literally, as the facilitator and Mark as the scribe, we just sit back and listen. And every once in a while, we'll ask a question going, just help me understand what happened here. Then that allows us to identify gaps and opportunities. So one thing about storytelling and one thing about facilitating listening sessions, if you've done any of those, because this is kind of the same thing, just more targeted, is that problems tend to rise to the top. You don't have to go in saying, we want to know about this, we want to know about this, we want to know about this. Like, when did you have a problem with your discharge? You don't start it that way. You start it by saying, tell us a story about someone you worked with who was experiencing homelessness. What happened? And then the things that are the worst, the things that work the least, start rising to the top, and then you start finding commonalities. And for that part, I'm going to turn it back over to Mark.
Thanks, Tina. So what you see here is fairly typical of a discussion summary. You all know by now that I am a designer. However, you don't need to be a designer to do this work, clearly. The only thing that qualified me to do this work was that I had a number of different colored Sharpies. So what I tended to do was, in black, draw out the steps 1, 2, 3, 4, 5, and then in blue, I would talk about what some of the qualifying statements were that people were offering as part of that process. And then I used red to say, here was a problem, and I used the purple to say who was in the process. So anybody who's acting as the scribe can be doing this in whatever way they're comfortable with. But the great thing about having big sheets of paper taped to a wall is that you can just track that process as people are telling the story. And then the clarifying questions just come out sort of naturally. And because I'm a designer and I'm a very neutral party in these conversations, I can say, wait a minute, hold on, I don't understand. So who was that? So then all of the people in the room are helping me build this description of the service delivery. And it really turns into a team effort. And that's another thing that builds that sense of we're all here to help this person, because what we're doing is describing step 1, 2, 3, 4, 5 of that client's experience. And so by pitching in on this conversation and actually building it in real time, what you see here are 3 different stories that we tracked. So these groups did excellent work helping me understand it so that we could move to the next step, which is what we call service design in the business. So after the meetings were finished, Ashley, Tina, and I would come back together and we would have these conversations about these stories just to get more clarity around who was doing what at which point. And then we create these visualizations because it's really important, we believe, for the teams going forward to have a sort of a shared landmark, an understanding of this is the story you told us, these are the people that were helping that individual, and here's how that tracks across that experience from the standpoint of the client, the worker, the gaps, the overlaps, and the opportunities. Clarifying roles and resources, really important part of this process, because we were hearing from providers around the table, oh, we've got a fund to buy bus tickets for people if they need to, go back home, or, oh yeah, that's part of our responsibility. And, if there had been some sort of conversation, we could have jumped in at that point to help to resolve the issue. So a service design visualization, again, does not need to be too complicated. This is actually done in Microsoft Excel. And what you see here from left to right are questions we were asking, and then the actions that follow those questions. So you see a lot of yes, no, as you go down. And then the elements in the lower part talk about where were the training opportunities for people, or where should we have been asking the question, do you currently have housing, or where did you stay last night before you came to this appointment? So because I'm a designer, I do things in color and color code. It's a very effective way to tag information in a matrix like this, but there are myriad ways to do that. So then we were talking about how do we take the components of this experience and put it into a metaphor that everybody can understand. So we developed a concept called the belt and pulley. And what you see here, the pulleys are the systems that are working on their own: homelessness prevention, behavioral health, and physical health. And a lot of times those systems are like pulleys, and they're spinning on their own. They're relatively disconnected because they all have specific jobs to do. The way we describe the experience of the individual between those systems was they are on the belt themselves. So they're moving between, and then all of these color-coded conversations took what we did in the individual meetings, laid out and clarified in the Excel file. And then we came back to our groups and said, we described the belt and pulley, and we said, is this how this works? And so we got verification that, yeah, oh yeah, that makes sense to me, because now I can see where that individual is at each point in the process. So what you see here is a follow-up conversation with one of our groups to track some of those stories that we'd heard. But also, if you can see in the purple, you can see who is responsible and which parts of the organization were responsible for that individual at a certain point in time. We moved that to a much cleaner version to clarify the metaphor, and again, to create this tighter shared landmark. And then, for the benefit of everyone involved, we created short video segments to talk about what this concept means. We have a number of them that are on a Vimeo page. And when you get the PowerPoint after this presentation is done, all of those links are a part of the PowerPoint. But there's also, as Tina mentioned earlier, a full website with all of these resources available. So you can go and check them out, and we'll give you that information as well. The reason we do these 3-minute videos is so that we don't have to have the 30-minute conversation with all sorts of different people. So if you send them a link, they can watch this quick video, give their feedback, and either with a survey or comments in the actual Vimeo page. Then you've already had the conversation. You've had the opportunity for people to interact with the idea, tell you what they think, and move to the next stage. Tina.
Okay, so now the proposed solutions. So Mark, I think, used the words handoffs or where procedures can be improved. So basically you look at all that information and go, where do people move from one to the other, right? So we find those. And then the willingness to try something different kind of goes back to, in fact, most of these go back to, do you have a system in place? So you've probably spent, if you do, you've spent a lot of time creating something a certain way. And I'll get to one of the things we changed in just a minute. Well, no, maybe I'll do it right now. So one of the things was, we say, no, we have a call center and we have street outreach. And the way you get, and you can come through a shelter, but you're still going to have to go through call center, street outreach for our coordinated entry, right? For entrance into our system. Well, that doesn't necessarily work when you're connecting with some of these other systems. So we had to take our, I'm thinking of a Munson Cadillac hospital, and the person who carried this out is actually on this call, but we had to be willing to say, no, okay, we will take a, okay, you can text us. You can text the street outreach person directly. You don't have to go through the call center. Oh, well, we can't really text. Okay, you can email. We can't really email. So it actually ended up that all they could do is leave a voicemail. And she was like, okay, then that's what we'll do. So you have to be willing to stay within your what you already have figured out, right? Your coordinated entry plan, but have a little bit of a diversion here and there, or these people just are not going to connect with you. And if they don't connect with you, we're back to why aren't you people talking to each other? So it really is your job to make sure that those people can connect so that the client has the best experience. Who needs to be part of the solutions discussion? I'm going to tell you that 99% you need to assume that it's your side. Now we're going to talk about one where you'll see that they were missing some very key things, but assume that you are going to have to make changes to your projects, which means which projects need to change. So who are the people in those projects who can actually make the policy and procedural changes? So they need to be involved in this too. So you need to, hopefully you have some committees already that might make sense to make that happen. But if not, then call them all together. Tools that might be helpful. So Mark talked about videos. We've done some recorded training type things, decision trees. There are a lot of different things, and it depended on what they said they wanted, and I'll get to that too a little bit more. Again, share. So then we went back. So let's say we put together some, let's hope we put together some solutions. You take it back to that first team, the same people who told you stories, the same people who could make changes, and said, will this work? What do we need to tweak? And usually you have to tweak a few things, and that's okay. You come back at all, again, you're good with that. And that's why it says, don't expect that the first thing is the end all be all. Obviously, with this COVID thing, I think we've all figured this out. If I said this to you a year ago, some of you might have been freaking out, but we've already figured out that we just can't do what we want to do anymore. So maybe we're a little bit better at that, but assume that this is a process. None of this is ever the end. And even if you had the perfect process that would carry on, I am here to tell you, as the voice of retiring experience, if you don't keep those conversations live and happening, it's going to change. But that being said, part of what we're trying to do here, and this is going to sound a little strange, but we're trying to create a cultural change. And we talk about this a lot in our little group. And that is, we want you to start working together differently. And I always say to people, I want you to stop looking at your phone and saying, should I pick this up and call someone that I know I should connect with? And start thinking, what if that person were in the next office? What if I could meet that person at the coffee maker? What would I talk to them about? We need to start doing a lot more of that. So part of this is, once you start having these discussions, you create a cultural change of working together that you didn't have before, and more of a closer community. I also had on there hold regular checkups, but I think Ashley's going to cover that. So just remember, there's different solutions based on different needs. So you heard all these stories. We did different things. We did one on discharge policies, one on service duplication, one on systems connection. This process of doing this, telling the stories, mapping it out, it's all still the same. And remember, as you're developing tools, that you do what they want, which I think Mark is the next one real quickly. So one of them was this Munson Cadillac that I talked about. And one of the things that, in just hearing that story, what we learned from them is they don't ask people what their housing issue is. So if you didn't hear a story and go, wait a minute, so how did you know they were homeless? We never could have done anything to change discharge. We found out and actually the exact same thing happened at our addiction treatment services, so our substance use disorder clinic. They didn't ask people, so there's no way we could connect with them early. Well, now they ask early, so that was a change on their side. And then they connect with street outreach right away, so that outreach worker can come in and start trying to divert ahead of time. So instead of that person, you have a day to figure out what to do with them. Now you have a couple of weeks. So but what they wanted was this kind of a decision tree. And they just wanted, here's what I do, but in this kind of a way. Here's how you ask the questions. Here are the questions you have. Who takes it from there? Mark?
Yeah, so we took all of that lengthy prose, and this is where it is handy to be a designer, because to lay out this type of an organizational decision tree. But the one thing that was interesting about the Munson Cadillac conversation was we were saying, could we incorporate these questions into the electronic health record so you're prompted when someone is coming in? Or could we create something that could be maybe a mobile website that you'd have on a phone? And basically they said to us, well, what I really want is something to pin up in my workstation to serve as a reminder, or an electronic PDF that I can print out and give to someone who also needs to have this information. So, you know, there, as Tina said, there are lots of potential possibilities, but by asking the folks at Munson, what is it you need? We were able to create really low cost, very high impact printed or printable pieces that really serve the need exactly as they've expressed it. So Ash.
Thanks. So the next step, confirmation and implementation of some of the tools that and the processes that Mark and Tina have talked about. And this is kind of where I came in. So at the time we were doing a lot of this, I worked at the HARA and had a lot of our program, our service delivery programs there centered at the HARA. So I think that's a key distinction. I wasn't necessarily in the director role at that time. So back to what Tina said, it's very important that you have decision makers at the table that can make not so high level that there's not an understanding of the on the ground day to day in the weeds work, but kind of that mid-level who can really make process and procedural changes with your staff. So I think that's huge. And so when we would go, we would hear the stories. Mark would draw up some really cool prototype, and then it would be my job to kind of bring it back to our team. And sometimes it wasn't just our HARA staff, it was other service providers throughout the coalition, and make sure that that made sense to them, get their buy-in, make sure I was also advocating for them, the end goal, right, being that this is an easier process and less clients have struggles, but at the same time, we want to make sure the staff have the capacity to do this. Because at the last point on the slide, if we can't do what we say we're going to do, it will all fall flat. We don't want to overcommit, but at the same time, we can't just say yes to everything and then in turn actually be able to do nothing, because we've committed to absolutely everything. So we want to be actionable and relevant to the different stakeholders that you're meeting with. And I wrote this down in my notes as these guys were talking. We have to, you have to have some humility in doing it too. And I think Tina talked about this as well, but humility, you have to be able to sit there and listen to people say that the homeless, that you're not serving anybody and that there's no call center and and just say, okay, and really take that into consideration that you aren't doing something right to communicate that, or to market your services or whatever the case is. So I want to make sure we would thread in humility throughout this presentation, because if we don't have that, we can't be actionable in our communities. And then next, this is still me, right? Sorry, yeah. I'm trying to follow along on the side too. Okay, so confirmation and implementation, having ownership across service sectors, that means us. I don't think I need to reiterate that anymore. Tina did a really good job of giving you guys tips and tools on how the service, the homeless service system needs to show up and be there. The one thing I'll add to that would be to also remember to stay in your lane and be a tireless advocate for ending homelessness. I want to kind of put it out there that we didn't come to these meetings getting down 17 rabbit holes around whatever people came up with. We were able to hear that and listen to that and always be thinking, how is this related to ending homelessness? Because if we're not doing that, we do run the risk of getting sucked into things that and saying yes to things that we have really no control over. So having ownership in what we can have ownership over, which is the work to end homelessness, and being actionable within other systems that have true interactions with ours. So with this, we provided navigation training. Tina mentioned this. Some service providers in the homeless world got together. We provided outreach and navigation training to community health workers. We also trained them on how they can fill out or start the process of filling out the HCV paperwork for clients, what eligibility looks like for that, teaching them how to do a verification of homelessness. And then we brought in the Cleveland Mediation Center to do diversion training, and we opened that up at free of cost to, we were targeted in who we were offering it to, but we did open it up to other service providers and some of these system providers that we knew really had a chance to divert people before they got to our system. So they went through the training. Some of them actually, I think folks from the health department are now trained the trainer on diversion. So that's, all of those things are beefing up their system, and they're also beefing up our own because we don't have to do it all. And then we have some videos describing options for solutions. And I think Mark is gonna, if we don't share them here, we're gonna send you guys the links to that. And I think that's the next slide. So we'll send the links to all of these videos. And I think this one is, if you didn't get a good understanding from us, this is the video, the summary video of the work that we did. And I think it's high level enough and kind of general enough that you could just use this in your communities to kind of start the conversation. And then finally, the last step would be setting up rechecking. So we don't want that, we say this a lot, but we don't want to be making something, policies, procedures, whatever, they are going to sit on a shelf and never be looked at again. I've done that way too many times. I think we all have. So we want to set up a quarterly schedule of rechecking that, reconvening the groups, doing maybe, we haven't done a lot of this yet because we're just not in implementation that far down the road yet. But once we do this, I envision this doing a little bit of storytelling. So doing having people share their experience of what it looked like prior, if they think it's working, just through talking, and then actually digging into the tools and seeing what needs to be tweaked. The huge thing about the tools, though, is then making sure that you communicate back to all the staff in each system to make sure that they know what is happening. I think what we don't want to have happen with all of this is that, 10 people got together in a room, and then that's where it died and it didn't go out to the people on the ground actually doing the work. And that's key to having your great staff like Lauren, who's on this call, really being able to implement the work and being involved in the process from the beginning. And then you want to stay visible, stay in contact with these folks. We've had partnerships and different projects related to ending homelessness that we never thought would have happened since starting this work. So, and it's all built off of the trust and the relationships that we built through doing this process.
So I just wanted to mention again, the Shire website and the link that you'll have here if you download the PowerPoint. This is the comprehensive, I guess, repository of all of the work we did. It covers quantitative, qualitative research results. It covers the entire process, which we've laid out to you. The very first button that you see there is what we've learned. So it's basically 10 things we've learned and 10 things that you can do right away. And then we describe how we went into the work of connecting systems. And then later on in the later stages of the Shire project, we were working in Manistee County to talk about if people aren't truly homeless, or they don't qualify as truly homeless, which a lot of folks in Manistee don't do, then how do we support them as individuals and as a community by pulling together. So we're still working with Manistee on that. But all of that is described here and it's available to you. You can download all these resources for your own reference. And so I think at this point, we can open it up to questions. And I'm going to stop sharing my screen if that's okay, so that I can see all of you, because I've been flying blind here.
Hang on just so they can see the emails for a minute.
Sure, okay.
I guess you guys can get to this. I think, Jessica, we're supposed to give you this PowerPoint when we're done, I assume, right? And it's going to be up for people to get?
Yes, I'm not exactly sure how they're doing it, but I know that they are making things available.
Great, thank you. So then you can, don't worry about it, Mark. You can unshare. So does anyone have any questions or comments?
There's one in the chat. And I can't answer it. So I don't know if you guys, can you see that, Tina or Mark? About the ombudsman?
Yeah, I can read those out to you both. I can see them.
Okay.
Thanks. I thought I was off mute, but I was on mute. So, yep, we had a couple ombudsman. So it says, question, for those 3 examples, and this came in around the time that there was the slide with the pulleys. So for those 3 examples, did the long-term care ombudsman get called? I have advocated by stating they do not have a safe discharge plan, and then advocate for the facility to give a written 30-day notice and then refer them to a Center for Independent Living, to the Nursing Facility Transition Program, or it is also called Community Transition Services, to make a referral as long as the client has Medicaid. The client will get assigned to a navigator to help with housing and other supports. And then another follow-up to that was the ombudsman can step in and back up the client so they do not get discharged right away.
So I think the simplest answer to that is we're in a really rural area and we don't, as far as we know, we have no one we don't have people who serve as I can't say the word. But we don't really have, now that if you're talking about, are you talking about a mental health system? Or which system are you thinking of?
I just unmuted myself. This is Rachel.
Hi, Rachel.
Hi. So technically in each county, even if it's multiple counties, the long-term care ombudsman is assigned. Or you can go to the top, which is Elder Justice Initiative, which I actually used to work in the nursing facility transition program. So I had homeless individuals that would go into the facility, and then I've had people try to discharge them with trying to get them acclimated with supports and services, and it wasn't a safe discharge plan. So that was my way to work with the relationship building, like you shared, to getting involved with your long-term care ombudsman or with a community navigator through the Centers for Independent Living to advocate for more time, because that program has money that can help with first month's rent and deposit, can help with basic needs such as furniture, all that stuff to get them set up, but they need time to do that. So that 30-day written notice can really make a difference and help that person get a safe discharge.
So here's the thing. So for this project, we did certain things, right? So we had certain projects. One of them was just a smaller hospital in Cadillac. One was one of our substance use disorder clinics. One was with our local DHHS with child welfare and our local behavioral health. What was the other? And our community connections. So what we're saying is that this is the model for doing that. So each area, COC or local planning body, needs to decide who they need to work with. So what's not working in our system and who do we want to coordinate with? So that would actually be a separate project. So if we had, if we knew that was an issue here, then we would reach out to that group and say, let's talk this through. So really what we're talking about isn't a specific project, it's how you would do, how would you connect with people that you need to connect with in your area? This is like a model for doing that. So it's less about the services and more about how you get to talking with other people. So the answer is that wasn't one of our projects.
But I do think that that is the kind of the heart of systems work, and part of the challenge of this process is that you don't really know where it's going. And so even during your conversations with certain providers, you could say, oh, we really should have had this person at the table. So for the second meeting, you can bring in someone else, as long as you have a chance to bring them up to speed prior to it. And then they can contribute to the conversation. You learn as you go, basically, and people have to be comfortable with that.
And that is true. So before we were ready to get with behavioral health, when we started talking to our hospital, the people from working in the homelessness sector and the people working at the hospital kept bringing up behavioral health over and over and over again. So the next couple meetings, we brought in people from that system as well and say, hey, we really need you. Could you please be part of this as well? And then you're cognizant of when you need them and when you don't. So I think that maybe is something I didn't make real clear, but once you find out all the gaps and problems that may exist, bring your team together to do what they can do first. And then they don't all have to be there at the same time. If it's just your system, they don't have to be with you unless that makes sense for them to be there. So it's making sure that you're having the conversations with the people who need to be there, because that's what keeps the conversations going, instead of asking them to do things that may or may not be important to them. Any other questions? Right, Jessica?
I'm not seeing any other questions coming in on the chat. So folks, you can send your questions in via chat, or you can raise your hand, or you can just unmute and start talking. And there was one request for an emailed PowerPoint, but as Mark just answered in the chat, it'll probably be best to get it from the conference site, just because of the size there. So if people have any issues with getting things from the conference site, I think that there is an email available there. I believe it's probably Jason Weller who's going to be troubleshooting any problems folks have with that.
We do have someone with a hand up, but I don't know what to do with that.
Excellent.
I can start.
I do.
Okay.
Yes,
Good. Go
please
ahead.
do.
Great. You all can hear me okay?
Yep.
Yes.
Wonderful. My name is Sarms Jabra. I'm with the City of Detroit's Homeless Solutions team. And first of all, I want to say thank you for your presentation and how the intentional approach you're taking with getting many stakeholders together. My question is, I'm sure, this takes buy-in from organizations across the ecosystem. And what kind of strategies might you suggest in order to get that buy-in? Everyone's busy right now, responding to the crisis. So it's hard. I'm anticipating it might be difficult to kind of pull people together in the ways that you all have been able to.
So a couple things. So from the COC level, it's that's just the way we work. It's going to sound like it's irrelevant, but it actually is relevant. And Jessica keeps telling me that. But up here, we make our decisions through the consensus model. And so there's never any jockeying around for who has control because everybody has equal voice. And that just tends to have a better buy-in from that perspective. So from your services, right? For the other people, it's actually funny because we're going, the next one nut we're going to try to crack is juvenile justice. And that's like a whole different world because we're up here in rural northern Michigan, and we have a sheriff. We work in 10 counties, and we have a different sheriff in every county. And then some of the cities, if you call them cities, have their own police chiefs as well. So it's a real interesting trying to figure out who to contact and what to do. So Mark and I have been playing around with how do we get them interested? So the answer is you're offering solutions to something. So when we went to the hospital, we went to the substance use disorder clinic, they have patients in their, on their end who they don't know what to do with it. They don't know what to do. And what we learned from all of these is people really want to have somebody else say the bad news. So as an example, like I said, with the substance use disorder clinic, we now have it where they tell our outreach team as soon as they ask the question first, if somebody has housing problems, they connect with our street outreach team right away so they can come in 2 weeks before the people are released. Well, what we try to train them in diversion, and we've done a little bit of that, but really what they want, and this was true at the hospital too, is to have someone other than their staff be able to come in and say, we can't house you tonight. And we say, somebody else has to deliver the bad news. So somebody else has to say, it's really crappy to be homeless here. And here's what we can do, but here's what we can't do. And their staff doesn't want to have to do that. So, so if you can figure out what it is that you could possibly do for them, and not the answer, but to say, we can help you. We can give you a connection. We can make it so you're not sitting with that person across the desk from you and you have no understanding of where to go from there. So that's really been our biggest selling point, is that we can actually do some things for you. And now that we've done it with a couple of organizations, people have heard and they're more willing to want to be part of it.
I will say, though, that the advantage of the way we started this process was in being in person. So due to COVID, there's going to be just a bigger set of barriers there, especially when it comes to telling stories and being the scribe. As I mentioned, it's so much better to have a big sheet of paper on the wall where everybody's looking and working on something. Sorry, that's my dog. And so that there will be some challenges there, but I think, having come this far along, we're even here at a virtual conference, I think people are fairly forgiving now and understand that the work needs to be done, and we can do it just about as effectively as we would have in person.
Anything else?
Great. We just have that was very helpful. Thank you in response to your answer. So thank you for that. I'll give folks a minute to keep putting any questions in their chat or raising their hand. And then I just want to put another plug out there for folks. Remember to sign out for your CEUs by putting your name and just noting that it's for CEUs in the chat as well. But yeah, if anyone has any other questions, I'm doing the share screen function, but I have a feeling that maybe it doesn't work. It's not working. I don't know if anyone can see a slide from me about yoga tonight.
I can
It's
see
got
it.
oh, good. Okay. Okay. That's great. Because I can still see all of your faces and the full chat. So I thought that it must have meant that the sharing wasn't working. But I'm getting your CEU sign outs. But so far, no more questions. Anything else from our presenters? Well, we're kind of wrapping up here.
We thought we were done at 3 o'clock, and we were literally done at 3 o'clock. We didn't go for another 15 minutes. So good job, Ashley and Mark.
You know, if I can say, the one thing is that this does take time. It's not a short-term process. The things that we describe in our videos and in that website took 18 months to get to this point. And so if you are asking people to invest in this process, you have to give them the expectation of how much time is going to be involved and what their expectations are for input and feedback and what you're going to give to them.
Yeah, that's true. We said this will be about X number of meetings. We're talking about mostly it was 2 or 3, and then a final checkup at the end, and then some implementation maybe. But yes, you're right. We made sure that it was not a long-term investment when we asked the leaders if they could ask their staff to be part of it. Okay, Jessica,
That's great. Yeah, so I just want to say thank you to the 3 of you. This was a really informative session, and I think folks are going to be referring back to it once the materials are live for everyone. So I'm going to stay on for a bit to capture all of these names for CEUs, but thank you everyone, and don't forget there's the yoga this evening. See everybody tomorrow morning.
Thank you. Thanks everybody for coming.